Dr. Patty, are you there?
It's good to see everyone today, and I'm so glad we're all doing this together to help patients. In the functional medicine and regenerative medicine world, we have been doing stem cell IVs we call them baby stem cells. We've been doing that. We've been doing injectable peptides for some time. Last year, the FDA began to intervene more. We can't do what we call our baby stem cell IVs or intranasal procedures anymore. The FDA doesn't allow that, so you have to go out of the country to do it. The injectable peptides, bit by bit, the FDA is taking away. And so I think that there's a real wonderful thing about the patches now able to come in, and to really many doctors and clinics will be interested in this because we know these are so effective. So GHK copper was one of my favorite injectable peptides. And by that, I mean patients would inject just like with a little insulin-like syringe right underneath the skin, usually in the belly, every day for 30 days to get GHK copper into their body. What about the patches? Isn't that like the most amazing, superior way to go? And so when I saw that the patches were activating stem cells, that they had no actual GHK copper in them, but they were activating your pathway, I got very excited about it. And all peptides are, like GHK copper, those are just very short chain amino acids. And we know that our body makes those. Those are natural things. And so that's why the injectable peptides were basically pretty safe and effective, just like our stem cells were. But the cost of them and now the unavailability of stem cells and more the peptides makes it just wonderful. You can still get GHK copper injectable peptides, but they're about 3 times the cost of the patches, and many patients, probably a half at least, don't want to have to inject themselves with a needle every day. So the patches are wonderful. And that's why I got very interested in it. One of my patients recommended it to me. And so then I vetted it myself, my husband, some of my family, and then started rolling out to my patients. And I've just been doing this now just right at 3 months.
Wow, Dr. Patty. Have you looked at any of the research on the X39 when you did the vetting? You look at any of the studies, and do you have any opinion on what the studies were saying to you?
Absolutely. So that was the next thing, because anything that I vet, I look at 2 things. I first look at safety, and that's the same way that the FDA does all the trials. You do a safety trial first, and then you look at what we call efficacy, meaning does it work? And so I looked briefly into the phototherapy idea and how that actually works, and I knew that would be safe. And then I thought, can this possibly be effective? And I began to listen to David Schmidt. Karen, my sponsor with LifeWave, she's had given me a way. You go to YouTube and you do LifeWave Connect, and I would type in David Schmidt and I could see all of the different things he did. I was just wowed by him literally and his knowledge. And then I began to research all of the studies that there are on our website and look at them and just see that they've got great, good studies. And then I began to listen to all the case studies, which are so powerful, including my own. And I thought, yeah, this is just a no-brainer for me. So I'm very excited about it.
Dr. Patty, when she said she vetted it by looking at the research, she went to startx39.com and she clicked the research and patents. You can also vet it as a practitioner just like she did. There's a heart study. There's a study that shows that GHK peptide actually increases in the blood. There's a heart study showing that utilizing the X39, that the heart, it starts to function better. You can look at that study. And then you can also go to YouTube. There's actually another tab on startx39.com where is the LifeWave YouTube, and it is YouTube search LifeWave Health. search David Schmidt. And David Schmidt is owner, inventor, and CEO. You can also look at the X39 patent, which is on this site. We have a 20-year patent that says X39 does activate GHK copper peptide in the blood and activates your stem cells. Now, let's go back to you, Dr. Patty. You said also you have testimonial about yourself. You know, a lot of times we think of doctors, the MDs, as taking care of all of us, but we never think you guys have issues. So tell us a little bit about that.
I have very high sensitivities to supplements and medications and anything. I get more side effects than benefits. And so I was excited so much about the patches because of the fact that there was no actual medicine coming in. And so I began to try them myself. And the first day I put on the X39 patch, the very first day, and my husband had the same experience. We both put it on that same day. Within a few hours, we both felt sort of like the Energizer Bunny. And I literally felt euphoric that day and for several days after. And then that sort of the euphoria of just such a sense of well-being just sort of gradually dissipated a bit, so that it was more like normal, with a little bit of that good feeling. And now over the next 3 months, I have increased energy. I'm sleeping much better, and I have a better sense of well-being overall. So then I added the LifeWave patch at night because I have a lot of pain. I actually have been diagnosed with MS, and I have quite a bit of pain at night that would prevent me from sleeping well. And the very first night I used it, my pain was diminished about 50%. And I moved the patches around a little bit. I did the whole body pain. And the second night I had an 80% benefit. And now the last 3 months I've had 80% benefit. 80% of my pain, I would say 6 out of 7 nights is gone. And then maybe 1 out of those 7, it'll be more like 50%. But it's incredible. And so, of course, between all of the other patches that I'm doing, I'm sleeping much better, and I'm very grateful.
Let's talk about that for a minute. Let's first talk about LifeWave. So this is what she's talking about. So and doctor has symptoms. Remind me if I'm doing this right. Symptoms of MS would cause a lot of full body pain, correct, doctor?
That's correct.
So she puts a brown patch on her pain spot and a white patch 3 inches away. And David says pain is in the connective tissue. So she's breaking the connection of pain. Now, this is not reparative. She's using X39 to repair, but boy, why she's repairing, isn't it nice to get the pain away? Now, she talked about wearing it for full body pain.
Yes, so that's what I first did. You scroll all the way down to the bottom of the LifeWave patch page, and you'll see it has usage. And when you click that on, they have a whole lot of instructions there. And then if you keep going, you'll see there's several videos as well. I recommend if you have any pain, you watch all of those videos, and they're short, and you read what it is specifically for you. Like migraines, you can put the white patch on the right side of the temple and the brown patch on the left side of the temple. I've got patients I'm using that for. For me, I'm using whole body. My sister has knee pain. She's putting one on one side of her knee, one on the other side of her knee. But for me, I have to use 4 for whole body. And you go, wow, that sounds like a lot. But what you do is you put 2 on the bottom of your feet. Remember, white is right. So you always use the white on the right side, the brown under my left foot. So I've got a white and a brown on the bottom of my feet. And then I have a white and a brown on my shoulders. And that is my whole body pain. It's just amazing. You just can't believe it.
We know that it's 12 hours on to activate and repair and 12 hours off. Do you wear LifeWave during the day or at night, and why for you?
I've done both, but I think for me it's better because more of my pain is at night. So I do night.
Okay. So now so far, Dr. Patty's talked about the X39. And she's talked about the LifeWave. Do you wear any other patches? What's the next one you want to talk about?
I do. So I think Eon should go with 39 because Eon reduces inflammation. And when I was doing stem cells, I would tell my patients, stem cells go like honing birds right to the area of greatest inflammation. So that is exactly what's going to happen. And if your great inflammation maybe is your liver, then you may not feel a benefit immediately for energy. So you want to get all that inflammation down as much as possible too. And Eon is a simpatico patch with X39. So I recommend that one.
So this is what Eon looks like. Wow. And we've always talked about, we've never really understood from a medical perspective, but we've talked about how it always fixes the first thing you need to live first. Yes. But I love it. It's like a honing bird or a honing device. It's going to go right in there and grab your first thing first that's inflamed. And I guess that makes sense. Why you wear Eon with it is that David's always said that inflammation's an eater of stem cells. So if you're honing in the stem cells to fix the first thing you need first, and then you can reduce inflammation, that little stem cell's going to fix it even faster. Am I thinking that right, doctor?
Exactly. It's just something that works in synergy, and that's great, I think. And both of them in the day. I wear my X39 in the day and my Eon at night. Others do it that way. So you can sort of pick what you want.
So you can wear X39 and Eon together, or you can separate them, wear one during the day, one at night. The nice thing about these patches, and doctor, tell me if I'm getting this right in your opinion, is that they all have their own 12-hour clock, and you can wear them all during the day or all at night, or some during the day and some at night. And here's the great thing. You have choice. You get to decide what's best for your body. And what's nice about the Eon is that they call Eon the gentle giant. It's the rest and digest patch. It's the lavender of the line. They call X39 the workhorse of the line. So you can wear them together, and Eon can get that X39 working even stronger. Or if you're like Patty and you have a lot of pain and a hard time sleeping at night, she's going to want to use Eon at night to put her body in rest and digest. So tell me, did I kind of get that right?
Yeah, exactly.
It makes a lot of sense.